Hey guys, this is Dr. Izabella Wentz here. I have Dr. Kim Duramo with me here. She's a physician, speaker, and #1 best-selling author of the MindBody Toolkit. Dr. Duramo is the founder of the American Institute of Mind-Body Medicine. She's board certified in emergency medicine and attended residency at Emory University in Atlanta. After healing herself from chronic illness using MindBody tools, she now empowers millions to use the same tools to immediately shift their body chemistry and brain activity to patterns that create health and well-being. Dr. Duramo conducts online group training programs and speaks internationally to doctors, medical students, and the general public to teach self-healing tools. So Dr. Duramo, it's so nice to have you here. Welcome.
It's so great to be here. I love what you're doing. Thank you so much for having me.
Oh, it's my pleasure. I love what you're doing. Can you share with us maybe your personal story and how you got into the realm of mind-body medicine as an emergency room physician?
I got into mind body medicine like way before I was an emergency doctor. And when I was young, I had all of these, like I could feel stuff in my body. My mom used to just say, you could feel your body growing. So I was already really body oriented. And that made me really intuitive because you can get a lot of information from your body about what's going on around you. So I had no idea what to do with that at the time. And I, was in a lot of intense hostile energies and I had a lot of anxiety. So that kind of brought me into the medical system, and my family was in the medical system. My dad and my grandfather were doctors. But I knew that there was a huge component that was missing, like that no one was really getting about what's really happening in the body, that we're just kind of scratching the surface when we look at the symptoms and we diagnose things and we kind of think we know everything. But what we know about the body is so far less than what we don't know. And what we found out about the brain in the last 5 years is more than what we've known about the brain in the entire history of humanity combined before that time. So I was really fascinated by, learning about the placebo effect and how the body heals itself. And it was like, wait a minute, how come this isn't making headlines? Why aren't we putting billions of dollars to researching this? This is clearly the key to real health. And why get all worried with all these little problems when we know there's something within us that has the ability to overcome them? So then it was like I went through this path to go into medicine and become an emergency doc. And then I established my sort of mind-body osteopathic medicine practice alongside of that. And that was, for me, it was so nurturing. It was what I loved to do. It was where I could have my biggest impact in using my own talents and strengths. So over the years, I just have like grown and developed that into what I'm now doing, which is pretty amazing to be connecting with like hundreds of thousands of people, healing them. Like we're not managing your disease. We will get you free from that illness. So you're no longer a thyroid disease patient or Hashimoto's or, autoimmune, or all of these things. I learned a lot about why the body is manifesting that imbalance and what we can do to resolve that root cause.
Wow, that's beautiful. And that's so amazing. And Dr. Kim, I know you actually have a personal health journey as well with yourself going through chronic illness. Can you talk a little bit about your health journey?
When I was in medical school, I started to get sick. And, Izabella, we're focusing all day on pathology, disease, focusing on the problem. And your mind is constantly communicating to your body. So depending on that quality of that communication, you're going to either get well or the opposite and you get sick. So I developed all these imbalances and I felt tired. I started to gain weight. I had a ton of pain, like joint pain, muscle pain, migraines. And I started to get sick. Like I'd get a sinus infection, always getting these like viruses. And no one could figure what was going on with me. Like, what is wrong? So after seeing like a whole bunch of doctors and it's a couple of years, I found, this one doctor who said, well, you have clearly got, they did an infectious disease workup for like Lyme and like digging and digging and digging. He said, you know what? You have allergies. You need to go see this allergist. So I went to see like the best, Harvard MD allergy guy. And I sat there, and I up and down the whole arm, like I reacted to everything. I was allergic to everything. So he said, well, that's your problem. And you need these medications and you need these special cleaning solutions. And these are all the rules and stipulations. And like my whole life was just vanished before my eyes. doing what I wanted to do and traveling, being a medical student, I was like, oh my God, like I won't be able to run anymore. I had some weird form of like juvenile rheumatoid, whatever. I was like, wait a minute. I don't really believe any of this. And this is not my solution. So like right before I broke down into a puddle, like my life is over, I just was like, I woke up, like I snapped out of it. And from that moment on, I stopped looking. It was a dead end, right? I stopped looking there for answers. And I said to myself, you're going to have to resolve this within yourself. Now, prior to that, I knew about like the body can heal itself and the mind-body connection, but I was like trying to do it, like really working and trying hard. And like a lot of people, like you give them something, you got to do this thing. Okay, I'm going to work really hard at it. But that creates an inner struggle because I'm fighting and I'm going to work hard. I'm going to fight disease. And that will always, like you're always going to lose. If you fight your body, you're both going to lose. And so I had to learn a new way and a resolution of that and go deeper. And that's exactly what I did. And so like I didn't have the tools for that. I had to really create that. So these are the same tools that now I'm using in my practice. And in just 10 days, I was symptom free. My levels rebalanced. I no longer had all these, diseases and illnesses and pains and all of this inflammation. But it was a commitment because it really deludes you into the I'm broken, I have a problem, and I need this medication for the rest of my life. And people will say to me now, but my doctor said I have a real disease. My thyroid isn't working. Well, there are factors that impair your thyroid's ability to function. So some of them are your thyroid getting what it needs, which is your body needs to detoxify adequately. You need to break down your nutrients and absorb them adequately. And you need the blood distribution. Like all of these things are controlled in your mind-body system. All of them. Your how well the organs get the blood they need and how well you break down and absorb nutrients. All of this. And we can talk about it a little further. But my journey was through really discovering how to create the chemical environment in my that allowed the highest level of health and vitality.
Thank you so much for sharing your beautiful story with us. And I just think it's amazing how you're able to overcome this through your own commitment to getting better. I support a lot of people with Hashimoto's and thyroid disease. And a lot of times I don't like using the word patient and I don't like using the word warrior, which, I always want to try to empower people.
Good. Don't.
I'm a thyroid warrior. And I don't think that's a very empowering message to send because if you're a warrior, then you're fighting. And that's not really where we want our minds and bodies to be. So going off of that, what do you think gets in the way of our bodies from healing themselves?
What gets in the way of your body's ability to heal itself is either something that you're not receiving that you need, or you're getting too much of something that you don't need. So they could be like toxic foods and toxic substances, and you're just overloaded with toxins, or not getting enough of what you do need, the vitamins, nutrients. But on another level, we also need this whole other slew of things that are bigger human needs, like love and compassion. Love and compassion I found to be the most powerful forces on the planet for reversing disease in the body. And then the opposite is like, when I'm being judgmental, hard on myself, pushing myself, fighting, I got to fight this disease, that creates the stress chemistry that makes your body sick. So these are very, very powerful forces. Yes, they've been overlooked in conventional medicine. However, they've been proven to be very powerful factors in every major medical study we've ever done, right? Placebo-controlled studies, we look at the ability of the body to heal itself. And if that person believes they will get well, somehow it magically opens these channels to allow that to happen. Not just that they think they're getting well, they actually have cellular changes. Their lab values change. They had a tumor, now they don't have a tumor. They had an arthritic, painful knee, now they're walking fine and have full range of motion. We have more than enough studies to show clinically that this is true. But to understand it is a whole other thing. And things in our current medical system don't get adopted until we understand them. That's just how it's set up. Does it make sense to me? No. If it works, I'm gonna find out, hey, that's fascinating. Let me use that, and then kind of find out what's going on behind it. So, so what's happening in the body that's causing that imbalance? Most often it's that inner fight, like down to the core of it, fear and self-hate. So we just call it out. If I'm scared and I'm living in anxiety, there are multiple reasons why. It won't matter if I get the best, most expensive, high quality supplements on the planet, or if I live on an organic farm and eat organic food all day. If I'm stressed and I'm living in fear, my body won't absorb nutrients normally. It won't break the foods down so I can absorb the nutrients. It won't eliminate toxins to the degree that it needs to. So you not only have all this like malnutrition, like you're just not getting the nutrients, but you build up with toxicity in your body just from that one factor alone. And Izabella, it'd be funny if you're like, oh, this is like a 10% effect. Wow, well, we should really consider that. No, it's like 90% of what's going on in the body is due to this stress chemistry. Like it's a massive and profound effect. It's more powerful than any medication that we've ever shown to help reverse disease. It's more powerful. And that's like the key ingredient, the best kept secret in medicine, so to speak, is how extraordinarily powerful this is. So it is not to be taken lightly, and we can really go to town to use this in extraordinary ways.
Wow. You know, going back with stress is such a powerful predictor of disease. Back, I think it was in the 1800s when they first identified a first case of hyperthyroidism occurring in a woman who actually had her wheelchair pushed down the stairs by accident. And that woman developed Graves' disease because she was so terrified. Later on in the 1900s, a doctor was able to connect that about 85% of people with Graves' disease actually had a very traumatic, stressful event happening in their lives. But stress doesn't always come from the outside. It could come from the inside. So if we're hard on ourselves, if we're unkind to ourselves, just as if the world is unkind to us around us, that can potentially put us in that situation.
That's a trauma. That's a trauma to your system.
Absolutely. And I think, you know, I was looking at some research recently for my next book, and I was looking at a study done in rats, and rats were put in very kind of tough social situation where they were placed in the cages of other rats who had, you know, set up their little homes there. And of course they were attacked by these other rats, and then they were put like in the corner of the cage. So this was a very kind of a socially defeated situation where the rats definitely did not feel loved. And they found within a week, those rats' thyroid hormone levels had plummeted. Another study found that—
Right, and like, why isn't that making headlines, right? It's like, you gotta get that our medical system is not on board for healing chronic illness. Like, we just need to get that so we can get that off the table, because people are still looking to the conventional medical system for solutions. Like, okay, if you've got if your arm's off, we can get your arm off. Like, I became an ER doctor because I do believe in that kind of medicine. And if you've got a splitting headache and we want to get you out of pain, it's a great alternative. Are there other ones to get you immediately out of pain? Absolutely. But sometimes morphine, hey, let's give you some morphine. We're not going to pretend that you don't have appendicitis and we don't need to do something else. Surgery and medicines used in critical care, great. We'll get your heart started up. But everything beyond that, and certainly the underlying causes that led to that, we got to remember to look to something else, a system that has the answers that can actually address things at that level, because our conventional medical system does not. And they are not created to do that. They're created, I mean, it's a business, right? The pharmaceutical industry is a business. And as a business, it is not vested in not having any more customers, because you don't need those medications anymore. So let's just call that like it is, and now look at how we can use that appropriately and how we can be an advocate for our own health and use the other resources, vast amount of resources that are available that actually do reverse disease. And so what you're speaking to is very important, because that points to the root cause that we can do something about.
You know, and absolutely. And I think medicine in general is excellent at rescue care and emergency care, and I admire the work of emergency room physicians, nurses, and all the whole healthcare team. I think that's amazing. But I think
Exactly.
a lot of times we ignore those things that are, like you said, at the root cause. And one of the things that can happen is that the brain can actually interrupt thyroid and hormone balances. Can you talk more about how these messages do that? Because I know this is, your area of expertise and what you've been working on for a long time.
Your brain is constantly, your thyroid is constantly receiving signals from your brain. And one of the things that, that can either improve the function or impairs the function. The other piece is your adrenal glands, which are like the stress centers that kick off all the stress hormones. They sit, right up above the kidneys. Your adrenal glands actually have a feedback loop to your thyroid. So a lot of times if the thyroid's not at 100% or not functioning normally, the primary problem can come, the chemical problem can come from the adrenal glands. And that has to do with all your stress levels. So you can overcome that. The other greater piece to consider is what's happening in your brain, because your hypothalamus, your pituitary, these are all glands that create hormones that tell your thyroid what to do, to secrete hormone or stop secreting hormone. And the activity that's happening in your brain will influence those glands that talk to your thyroid. So it's a communication. If you've got this memory of a trauma, of a stress, or even just like, I'm really angry about something, or wow, I gotta work hard and fight to make my life work because I have this limited belief about myself on what it means to be a woman, or what I'm supposed to be by the time I'm 40, I should have blah, blah, blah. All of these things create an inner fight, an inner turmoil. And it's keeping your brain busy with the messages of this fight, this lack, staying in fight or flight. It depletes your whole body. And it communicates messages to glands like your thyroid that prevent total health, prevent that vitality. Your stress response also, your cortisol levels, your stress hormone is going to be super high. That in and of itself impairs your thyroid function. So there's so many reasons we've shown what's happening. And it's really a matter of getting to what can we do to address things at that level? But that's not something most doctors have in their toolbox.
Yeah, absolutely. And also, you talk about, what's going on with the thyroid if your labs are normal. Can you talk about how a person may still have an imbalance?
There are factors in your bloodstream that can absorb your hormones. Like it can attach onto the hormone and render it dysfunctional, like render it inert. It's not active. It's not in the active form. So even though your thyroid's kicking out thyroid hormone, then you have these like receptors that will kind of glom onto them. It happens a lot in pregnancy, and it will make it so that it's called functionally euthyroid. So you're at a normal thyroid, but you have illness of thyroid disease, and it's really common. The point of the matter isn't, wow, there's this whole other layer of complexity. Maybe we should do those lab tests and look for that problem and then come up with some great solution for that. The mind can get us on like running down a rabbit hole of complexity, chasing the problem. But what we found is that the more cut up we get trying to fix a problem, the more complex and the further down the rabbit hole we go, without necessarily bringing anyone into greater levels of wellness. The opposite of that is to instead stop looking for the problem, focusing on the problem and fixing the problem, and be up to the business of creating wellness. That is an entirely different paradigm. And it's not what we're taught in medical school. We're not taught, even as, as osteopaths, we find the health, support the health. There is a big thread of that. But in osteopathic medical school, we still end up, most people go into an allopathic residency, they get allopathic training, and they practice allopathically. In true osteopathic medicine, it's about finding and supporting the health. So for example, Izabella, you love your husband. You guys are beautiful. Like, you just like kids. You have this beautiful chemistry, and it's fun and playful to watch you. What if we were to have you think about your husband or spend time with your husband? You're going to be in a different chemical state, even just thinking about him and thinking about your relationship. like you're already smiling and glowing, that creates a chemical response in your body. It creates changes in the activity and firing of your brain. And Bruce Lipton has written a lot about this. He's a molecular biologist, and he has a book called The Honeymoon Effect. Like, you're not creating cancer cells when you're in love. You don't even need sleep. You don't need to eat. You don't hardly need anything, because there's some force sustaining you. When you're passionate about your work, right? You're an entrepreneur. I was up past midnight last night because I was shooting my video for my book launch, and I wanted to reshoot it because there was one thing that I knew I needed to change. And I had so much energy. I was like, I'm doing this. I really care. I really want people to get this message, and I want to support that. So my husband totally gets it. He's like, do what you got to do. And I woke up today feeling amazing. Well, chemically, I'm lifted, right? My passion is going to inform what's happening in my body. Now, I'd feel totally different if someone said, you have to go to this job and do this thing and work past midnight and get up at 6:30, your daughter's going to wake you up. It'd be like, oh my God, I can't do this anymore. I hate my life. I am dying. Chemically, you have a whole different environment. And the work of like Bruce Lipton and so many other people, Candace Pert, they've shown that your emotions, the chemistry of your emotions, directly impacts every cell in your body. So if I'm living in joy, I've got my purpose, I know what I'm doing, I'm excited, it literally reverses disease. It even influences your genes. Your DNA is affected by this. So how can I get you to access that juicy love energy you have for your husband and bring it with you in every moment, carry it throughout your life, no matter what you're doing? That's what I'm showing my clients, and what we're doing is exactly what we're doing, essentially, in multiple different ways.
Wow. That's amazing. You talk about really focusing on the positives and focusing on how to get that positive energy in your life. And, this is why I love sharing success stories, because I think we, like you said, we can go down a rabbit hole and talk about all of these different problems that we could turn up. But I've always believed that the more problems you look for, the more problems you find. And the more successes you produce, the more successes you identify, the more you're going to produce. Can you share a success story from your work with one of your thyroid patients?
Oh, yeah. I have this incredible patient. And, to your point, what we focus on expands. And a lot of people have told me, like, oh my gosh, you're so positive. And I wish I could be that positive. And I get responses sometimes, like if I do a summit, I was on Trevor Cate's summit, and someone wrote, well, we can't all be that positive all the time. And so I thought it was really funny, because I was like, wow, my work really isn't about being positive. And so I'll just tell everybody, like, forget being positive. If you're mad, like, be mad. Like, just be in it so fully that you have no resistance, no judgment on it. You're not trying to be happy. You're not trying not to be mad. It actually changes everything. And what happens is it allows emotions to, like, flow through your body, and you experience them and they move. It's okay to be angry. It's okay to be, like, whatever. Hateful, judgmental, like, it's going to happen. You're going to feel some, like, misery or whatever. And can I just let that move? Or do I have to, like, try to be positive because Dr. Kim told me it will make me sick if I'm not? And I'm not telling you that. It's a little subtle nuance, but it's important. It's more about being in a state of love and acceptance for, like, whatever comes up. And that is what allows harmony in the body. So I had this incredible woman, and she had gained like 30 pounds, depressed. Her relationship was falling apart, miserable in her career, like failing miserably. And she's like, my life is falling apart. And the doctors told her she had thyroid disease. So that's really what brought her to me, is like, this has been going on for a couple of years with depression and all of that. She had a nodule in her thyroid. They found it on ultrasound, and they said, we're going to put you on medications. Come back in a few weeks. We're going to retest the nodule. She did not want to go on medications. She said, I'll come back and get retested and see where we are then. So she started working with me then, and we used a bunch of the different MindBody tools that I teach, and one of them is EFT meridian tapping. And you're basically just giving new information to your brain to get your brain to stop those toxic chemical messages. This works incredibly well for the communications to your thyroid. So we just tapped on all this old stuff in her system. I'm not good enough. which is like what was coming up in her career, the whole interpretation of like, I'm failing. I don't deserve a great guy. And then she also had this piece around, if I'm successful in my career, I can't have a great relationship. Like it was a trade-off. Well, if you have that perspective, I guarantee you, like how you show up to your relationship is going to be, it's going to change everything you experience in your relationship. So it was almost like she kept bucking him and resisting, totally surrendering into love, into this awesome relationship, because she didn't want to lose her success. So she held back from this man she loved because of that belief, because there was a real threat. So we resolved all of these things. Some other pieces around self-nurturance. Like she was like working hard, fighting hard, pushing hard. And in her exercise, it was like, I gotta fight my body, because she's like gaining weight, hating it. And I gotta keep running. I gotta push myself through this. Not a self-love, self-honoring kind of movement exercise. It was like a fight. So of course, eventually, you know, if you fight your body, you'll both lose. And the body's like, I'm conked out. I got nothing for you. She couldn't run anymore. She had no energy. Like, because after a year of pushing herself to run, she's conked out. Well, what happens, right? Your adrenals are like depleted, and now your thyroid shuts down. So all of these things are the tip of the iceberg. The other inner conversation has been going on for decades. So we did the work with her, and she just immediately felt energized, empowered, clear, inspired, no more depression, felt awesome, had a huge breakthrough in her relationship. And then when she went back in a month, and they're married now, very happy, and she's soaring in her career. She went back in a month, no nodule on her thyroid, completely normal thyroid function.
Wow.
Didn't need medications.
Wow, that's just amazing, you know, and I love stories like this because they just go to show what can happen when you actually apply some of these wonderful resources and tools that you have. Now, can you tell us exactly, you know, MindBody Toolkit and MindBody Medicine, what does that mean to like an average person? If I were to come in and be a client of yours, you know, what kind of things would you take your clients through?
Well, the first thing that I think this is the number one most important skill that any of us can gain for health, for our wealth, for our success, for our relationships, is to get present in your body, to bring your awareness into your physical body and like anchor it in here. Your body is constantly receiving lots of different information, and you do have access to this immense wisdom, like your higher mind, your higher wisdom. You have access to the solution to any challenge that you could ever face. But depending on how you're using this interface, it's just like plugging into your computer and accessing the internet. You could go and look on, you know, howtofixmyproblem.com, or I have thyroid disease, help me. You know, you could get these chat groups of people telling you how bad it is. And, oh my gosh, you're never going to be better. And, oh, I think you need this medication, but here's how to deal with the side effects. And you could be managing your problem all day. Or you could ask a question and say, how do I live my most vibrant life ever? And you're going to find like Izabella Wentz, you know, and you're going to find a solution. And your mind works the same way because that information is out there. I have this great friend, Tommy Baylor. He just wrote something like what you want is wanting you. And it's a genius book. And I'm like, Tommy, this is the same thing that I'm teaching, like medically. What your inner inspirations for wellness, well-being, vitality, you want to be like fit, sexy, sassy. You want all that, but it's not because it doesn't exist and it's a pipe dream. It's because that's your true inner state and it's calling you, you know, it's there for you. So can I begin to ask different questions? And one of the tools in the book is how to ask a better question. Your mind is like a little puppy dog. And if you ask it, what's wrong with me? What's wrong with me? What's wrong with me? It's like you send out that little bone, and it's going to bring that bone back to you. But what if I send out the bone of where's my most amazing, expansive life where I'm, you know, wealthy beyond imagine, experiencing the world and sharing it with everyone, sharing my vitality so that others come into well-being and the whole picture. And I say, what's the one thing that I can do that's going to bring that into my life most easily? And I throw that bone out there. Now, you've got to sit in the knowing, right, of it's coming. And your mind, I guarantee you, will bring you the solution. But what happens, right, is, oh my God, well, that's so easy for her because she's blah, 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 you know, and you make up a reason why you can't have that and why that won't work for you. And what happens when we're in the delusion of illness, the delusion of the medical system, is we really believe we're broken and there's a problem. So we need to change a lot of our mindset and perspectives. But what happens, and I have this quiz on my, I have this quiz I give people where it's like the 3 biggest things holding you back. And one of the profiles we talked about a little bit is like fighting your body, battling your body. If you're battling your body, you will both lose. But the other one is this primal fear that I'm not enough. I need to keep doing more. It's not enough. I need to keep going. It's outside of me. I can't possibly have the answers in here. And then the other piece is like, you've been hurt, you've been victimized, you've been wronged. And it's like, okay, just let it go. Well, you can't just let it go. You need to receive what you need. And sometimes that's in the form of validation before you can have that completion and move forward. Well, isn't getting diagnosed, finally, they have a solution, you know, an awareness for my problem. Isn't that validating? Yeah. So then sometimes people stay stuck there. My fibromyalgia, my chronic fatigue, my thyroid, well, this is my ADD, and they have a reason to kind of blame all of these things on when really they could transcend those characteristics very easily. So we can go through a little bit of connecting here. So I think it would serve people. We can do a little exercise.
Yeah, that would be great.
Okay. So again, like I said, this is the one thing. If you're going to do one thing to reverse disease, to heal your body, to empower yourself, you have to get present in your body. So I call this the instant elevation technique, because really it instantly elevates chemically what's happening, elevates your state of mind, your brain function, and brings you into a higher state of awareness. So you can get access to, you know, like when we're in that stress state, our brain is like, how do I fix this problem? You don't see the big world. You don't see the big picture. The world is flat. How can I get into that perspective of, oh my gosh, of course, like now I understand and now it makes sense. I can do A, B, and C. I can create this new change. So empowerment. Okay, so you can close your eyes and feel your body rise nice and straight and your spine nice and straight. And just take a few deep breaths. Breathe slowly in through the nose and then let it go. Relax your shoulders. And I want you to bring your awareness and your attention into your physical body. And you can start by imagining a giant magnet in the middle of your head. And this magnet is going to call all parts of you right into the spot in the center of your head, right back into the center of your body in your head. Any part of you that's off in the past of stuff that's happened, regret, I did this thing I wish I didn't do, or something that happened to you that you're still upset about, you just can't let go. I want you to let those circumstances dissolve, and you can maybe see them in your mind's eye, just see them dissolve. And then bring your energy that was invested in them and just bring that right back into the middle of your body. Breathe slowly and fully. And now any energy that's off in the future, like what do I have to do next? Oh, I don't have time to do this exercise. Oh, what I hope doesn't happen. I hope this does happen. And I want you to just let all of those circumstances floating around in the future, let them dissolve. And let your energy, your attention, the parts of you come right back here into the center of your head. And this magnet, this big giant magnet in the center of your head is just going to suck it all in right now. So that just completes. Now put a second magnet down in your heart, and you want this magnet, big supercharged magnet, to pull your energy all the way down into your chest, into the center of your chest. Pull your energy from your head all the way down into your heart. And then put a third magnet down in your pelvis. And let your energy pull all the way down to your core. So you might need to move your hips around because sometimes it's hard. We don't really feel our bodies to this depth very often. But I want you to imagine this magnet pulling your energy, your attention, your awareness, your presence all the way down into your pelvis, just below the belly button, huge, big magnet. Maybe it's way bigger than your body. It's just going to pull it into this anchor, into this core, right in the center of your pelvis. Okay. And from this point, you're going to take a few slow, deep breaths. As you breathe in, you're going to let your belly expand out. And as you exhale, you're going to let your belly sink back in. So take a big, deep breath. Relax your belly, relax your pelvis, relax your shoulders. Let your belly balloon out. And then relax. Let your belly sink back in. You want to do at least 3 of these. And this breathing turns off the stress response. So taking this time, I promise you, will be one of the most valuable, worthwhile moments that you've done for yourself ever. Relax and let your belly sink back in on the exhales. And then one last big deep breath. Balloon your belly out, fill your belly out, bring the air all the way down to your pelvis. Feel your pelvis moving with the breath. And then exhale. Let it sink back out. Now, I want you to, before we open our eyes, anchor part of your attention way down here in your pelvis. Part of you, you're going to assign it, because now that you've accessed your power, brought it back in to the moment, your body only lives in the present moment, you're going to assign part of your awareness, part of your energy to stay anchored in your pelvis at all times. So that even as you go about your day, part of you is attentive and present in your body. And then just slowly begin to open your eyes.
Wow, that was amazing. I feel great.
Well, this not only shuts off the stress response, because we come home in our body, but you change that breath cycle from like the shallow breath. Whenever we're stressed, we're breathing in our chest. It's shallow, it's a short breath. And our sympathetic nervous system, the fight or flight stress response, is all located up here in the back of the rib cage. And it can't shut off and kind of get into the relaxation response when we're breathing in that stress breathing. So all you need to do is get present, bring your awareness in, and change your breathing. Just slow and deepen your breathing. So the tool is ABC. A is to bring your awareness present in your body, bring it all the way down to your toes if you can. And then B is to change and slow your breathing, slow deep breaths. So what's C? C kind of happens automatically, because now you're making choices, you're taking action, you're doing it from a more grounded, peaceful place. You are going to make different choices. You're going to have different tonality. Everything you communicate is going to communicate a whole different message. Even if you say exactly the same thing, it communicates, because we communicate in energy, not words. And you can also, the third way to use C is to intend, right? You're going to make an intentional choice. So, hey, I'm going to make this video, and I'm going to talk about self-healing. And I'm going to set the intention that this video is everyone's inspired, and that when they see this video, like, they instantly know they're home. They instantly know that they're gotten, that they get exactly what they need. So I'll set an intention like that. And I guarantee you that it has a powerful result, because people respond to those videos like so powerfully. And when I'm just going to show up, no matter how brilliant the thing is that I'm going to teach, if I've not done that, I lose that whole impact of that energetic transmission. So can I set an intention? Because my mind-body system will always follow it. If I say, I want to have an awesome date with my husband tonight, feel great, be excited, be in love, and we're just going to have so much fun and laugh a lot. If I've done A and B, that C is really empowered, because you got to get in your body to connect in your mind-body system before you can make a choice or a command to tell it what to do. You can't command your energy when it's all interspersed in past and present and worrying about what other people think and worrying about who you're supposed to be. You can command your energy when you let those things go and you bring it all back into your center. And you've distilled yourself down into the relaxation response. Extremely powerful. So that C is making that conscious choice to intend the outcomes that you really want.
Wow, Dr. Kim, that's amazing. Thank you so much for sharing this with us. I think this is something that everybody can do at home for themselves. And I know you also have a lot of really great resources for people in your book, the MindBody Toolkit. And where can people get your book?
Well, what you can do is my website is drkimdaramo.com, drkimd.com for short. You can go to drkimd.com. But I created a bonus just for you, for this group, and basically has this quiz that I told you about with the 3 solutions, the battling my body, perpetual victim, and there's those 3 components that I just talked about. And you'll get that quiz. So it's going to give you some video training right there. The second piece is the ebook version. I'm going to give you the first 3 chapters of the digital version so you can start on that. And the third piece is these instant energizer tools. That's part of a training program I did called the MindBody Solution. And it was a bonus I gave in that program where I teach people to work with these MindBody tools and I bring them deeper into the exercises. So these 5 quickie tools are going to increase your serotonin levels, balance your serotonin levels. That's like when people get on an antidepressant medication, it's to balance their serotonin levels, but you can do that yourself. Increase oxytocin, which is like the love hormone, and it also repairs oxidative damage. It reverses cancer, like very powerful, and decreases your stress hormones, so like cortisol. And then there's other, hormonal balancing. I kind of wrote it into the program, you'll see, but they each have a specific role. So if you're like really stressed out, you'll know exactly it's a 2 minutes or less to change your state. They're really powerful and they're really fun. And, I use them all the time. So you'll get those for free. It's a pretty great bonus. And the site to go to is drkimd.com/thyroid, because I made this just for your group, Izabella. drkimd.com/thyroid. And then you just enter your information and I will communicate with you ongoingly to give you further MindBody support, and any questions you have, I'm 100% available to helping you resource yourself.
Wow. Thank you so much, Dr. Kim. That's so generous of you. It's been such a pleasure having you on and chatting with you. You're just such a radiant light, and I appreciate you sharing your knowledge with our community.
Thanks for having me. I'm so excited for kind of like collaborating with you and any work we can do together. We've got a great mission here. I'm really excited about what you're doing. So yay us. Thanks for having me.
Well, thank you so much. It's been such a pleasure. I hope you have a wonderful day.
You too.